In this session, I'll give you my current take on the state that the field of trauma therapy is in. I will start with a critique of the mainstream therapy system, and the second part will be on some of the alternative therapies available. This might be useful to you if you or a loved one are struggling with the aftermath of trauma and want to know how to go about finding a good therapist and a good therapeutic modality to try, or if you're a trauma healer or a therapist of some kind and want to broaden your horizons and help more people, and perhaps network and join a supportive community of other therapists. I need to state at the outset that I'm not medically trained, so all that follows is merely my personal opinion and most definitely does not constitute medical advice. However, I am a double award-winning trauma healer and coach, so my abilities as a trauma healer have been recognized, and I do know a few things, so I want to offer my perspective here on the current state of trauma treatment and on some of the options available for people who are suffering and really need help. And I want to put forward my case that we need a complete overhaul of the entire established system, while also pointing out beacons of hope for a bright future for the collective mental health of the people of the world. I hope you'll get something useful out of this, and also that you'll give me your feedback. Do give me your insights and let me know whether you agree or disagree with me on any of my opinions. You may know things I don't. You may have had different life experiences than me, or you may simply see things from a different angle. We all have biases, and I may ruffle some feathers if you're easily ruffled. Perhaps listening to this is not the best use of your time. If you want to have an honest debate, then bring it on. I must also warn you that I will mention potentially triggering trauma cases. I'm going to use as a kind of foil for at least the first part of this discussion the work of Daniel Mackler, especially a few of the videos in his series of critiques and insights into his former profession of psychotherapy. I'll put a link to this YouTube series of his in the course notes, and I'd recommend that you listen to at least some of it if you're interested enough, as I will, for the sake of brevity, quote him with very little context. I really like Daniel and respect his opinions. He seems to have been a really good, caring therapist, but I find that I disagree with a few of his points of view, and I'll do my best to explain why. I'll also give my current opinion on other trauma experts, therapists, teachers, and modalities, some of whom or which I'm in danger of misjudging for lack of a thorough enough knowledge. So I reserve the right to change my opinions in the future on the basis of new evidence, and I'd welcome corrections if I've made any glaring errors of judgment. As with shoes, one size doesn't fit all. Someone who needs help to heal trauma must find a therapist and a modality, or a number of therapists and modalities that suits them. I'm biased towards very fast healing work, as I want my clients to spend as little time as possible in therapy and as much time as possible in learning to live life to the full. But some people prefer and are more suited to a slower, more methodical approach, and some very effective therapists and therapies will cater for this. What I really want people to understand is that they do have options other than the better known mainstream ones, some of which may actually be far more effective. So, let's begin. In his Why I Quit Being a Therapist video, Daniel Mackler gives 6 main reasons. Because he was a good therapist and a bad system, I want to summarize, then comment on each reason he gives for leaving the profession. Daniel's first reason is the mental health system itself. Daniel regards it as ironic that the system that is supposed to help bring people who have mental health problems back towards mental health is itself totally screwed up.
The system presents itself as science, but it's not science. It's not even really social science. A lot of it's antisocial anti-science, or maybe antisocial pseudoscience.
I consider myself extremely lucky not to be a part of the mental health establishment, which, as I said, needs a complete overhaul in my opinion. I plan to see this done in my lifetime. In the system, therapists are supposed to diagnose every client, which Daniel found to be quite arbitrary, stigmatizing, and often harmful. He would rather not even use the word diagnosis, preferring to think in terms of building up a picture, an accurate sketch of the person's life, history, relationships, interests, etc., rather than simply attaching a label to them. In his Former Therapist's Critique of Psychotherapy video, Daniel says that he feels that really good psychotherapists should not specialize, but should be able to work with anybody, any kind of problem, getting to the root of the trauma, having a great understanding of trauma, especially in childhood, because the real problems that people have are human problems. They're all kind of trauma-based. They just play out in different ways. And I agree with Daniel. I list on my website and business card depression, anxiety, OCD, grief and loss, suicide, phobia, abuse, PTSD, addiction, and eating disorders, all of which are traumatic or are legacies of trauma, and all are dealt with in a similar way. I think I should have added self-harm to that list, and addictions I regard as perhaps a special case, as they tend to have more aspects to consider and bases to cover. But it's this individualized sketch, this picture or poem or play of a person's life that has led up to them sitting in front of me, and this is what we have to work with. Having said all this, I do find labels to be conveniently helpful just sometimes. For example, if someone is in a narcissistically abusive relationship or is in a relationship with someone showing traits of borderline personality disorder, they can really benefit from knowing and understanding the typical dynamics of these and from being given appropriate escape or coping strategies. So I'm not writing off diagnostic and statistical labels completely. Whenever a patient was having some sort of problem considered out of bounds of what the therapist was able to help them with, or found it to be too stressful to deal with the client's problems, therapists are trained to suggest that there's some sort of chemical imbalance that requires an adjustment with medication, and to refer them to a psychiatrist to push them into taking psychiatric drugs for the conditions that they've been assigned, and then they're given more drugs to counteract the side effects of the first ones. Many of these drugs are unhelpful and downright dangerous, and it's difficult to get off of them. But when lots and lots of patients expressed a desire to taper off or stop taking a drug, that was considered beyond the bounds of the therapist's competency. So it's kind of a ratchet system that gets patients onto drugs which often do little good but much harm, and never let them get off. I have friends who've been forcibly injected with antipsychotics for decades, and they've had to live with the horrible side effects. And I have at least one acquaintance whose life has been destroyed by prescription benzodiazepines, which he's been unable to get off for years. I'll talk more later about natural mind-altering entheogens, which do have a proven track record of enabling profound trauma healing, rather than masking it and allowing it to fester, as many commonly prescribed psychiatric drugs do. But these profoundly helpful substances are not pushed on people who are suffering. They're instead outlawed and made inaccessible. Again, I want to see all this changed in my lifetime. Once I experienced ayahuasca, I saw the potential for combining ancient psychedelic medicine traditions with the trauma healing work that I do, as there are so many parallels. I had this idea of having sessions with ayahuasca ceremony participants to heal their trauma, perhaps before a ceremony, and definitely afterwards to assist with integration of their experiences of the night before, if they felt like they needed it. As is so often the case, when I form a hypothesis, I was subsequently proven right. I latterly heard of people who were combining psilocybin mushrooms with cognitive behavioral therapy, or CBT, and then went on to find that there's been a great deal of research already into psychedelic-assisted therapy. What both psilocybin and ayahuasca appear to do is set the stage for ultra brain plasticity, like a deep, fresh fall of snow, allowing totally new neural tracks to be laid down. My trauma healing tools do the very same thing, but are much more targeted, and some sort of combination of the two could be extremely powerful, like a kind of therapeutic atom bomb. Cognitive behavioral therapy, or CBT, which I do resort to where appropriate, does not have this neuroplastic power. It involves mostly the conscious mind, whereas psychedelics and the bulk of my therapeutic interventions plumb the depths of the subconscious mind, which is the only place that deep and lasting change can be made really quickly. Daniel got a reputation for being able and willing to work with clients with more serious problems, who often also have a lot less money. So his practice was weighted towards these cases, and he was willing to charge a lot less, where other therapists would state their fees on the first phone call so as to weed out those who were not able to afford them and those who had the more serious issues, who also happened to be more stressful for the therapist. So Daniel was under pressure to see more clients in order to make his business work and to earn enough to pay his bills. I've suffered from this same conundrum, how to help the worst off people without running myself into the ground and thus being no good to anyone. Daniel talks somewhere about this balancing act of taking care of oneself, charging enough for one's services as a healer so as to be able to remain to help others without putting therapy beyond the reach of those who really need it. The job was exhausting, and Daniel suffered from vicarious traumatization. He cried every day with his clients as they told him of their horrible, horrible traumas, most from their childhoods, and as he sympathized with their pain. He took on their trauma and became apprehensive and jumpy, and 6 years into being a therapist, he got sick with ulcerative colitis as a result. I don't do talk therapy. People close to me sometimes say things like, so-and-so is a counselor like you, and I say or just think, I'm not a counselor. Responses to trauma, think PTSD in general, are not logical. They're not rational, and irrational problems require irrational solutions. Many people find cognitive behavioral therapy to be very helpful, and as I mentioned before, CBT is one of the many tools in my trauma resolution toolbox, which I will use when appropriate. But the real power of what I do lies in trance work and what we call trance logic, which relates to the irrational pseudo-logic of the subconscious mind, which controls most of what we do as humans. I wonder if Daniel would have been less exhausted and burnt out if he had had tools which do proper subconscious mind surgery, rather than mostly relying on interactions with the logical conscious mind to filter down into the subconscious, which is slow and tedious and less likely to reap rewards. Up until 2023, I would have said that I was largely immune to vicarious trauma. I do sometimes find myself crying with or for a client in a session, but in general, in most cases, the results we achieve in terms of released trauma and a bright new outlook in just one session leave me feeling refreshed and elated. I've been able to create a whole new childhood for an adult client in one session. And this sort of everyday miracle is exhilarating to behold. I very much doubt that many of even the very best, most caring psychotherapists are left with this sort of feeling after any significant proportion of their sessions, which I'm sure must be soul-destroying, such dramatic wins being few and far between rather than the norm. I issued a challenge to God or the universe though, and in 2023 someone came looking for me, came specifically to my old hometown where she felt I was, to find me, and her trauma affected me deeply. The sort of childhood trauma which would leave the majority of lesser mortals dead or in a straitjacket, and I suffered severe vicarious trauma. I already had many, if not most, of the most powerful, cutting-edge trauma healing tools in the world at my disposal, but I found that I had to modify and invent techniques on the fly to deal with and resolve quickly her horrific flashback memories, which had previously lasted for up to 14 hours under the care of good, well-meaning mainstream mental health system professionals who were powerless to intervene other than to offer comfort and support. Daniel did years of supervision as a psychotherapist, but found that it wasn't supportive. It was really good training on how to play the game and avoid telling the supervisor things that would result in punishment or harm to him or his clients, especially in preventing clients from getting sucked into psychiatry and mental hospitals. He learned that he couldn't talk openly with his colleagues either, though he was friendly with them, leaving him professionally very isolated. When colleagues figured out that he could actually work with really troubled people, they would send them to him because most of them wanted to get rid of the really troubled people. He got his support from friends who had more common sense than his fellow psychotherapists. He thinks that the mental health system burns the common sense out of people. Some people who really had a natural gift for being a therapist went through all the training and ended up worse therapists as a result of the training once they got their licenses. Daniel also found clients to be supportive in their appreciation of him, and he read books on critical psychiatry, and he did a lot of self-therapeutic, self-supervising journaling on what he was feeling, what he was going through with his clients. After about 6 years of interfacing with intense trauma all day long, he got sick with ulcerative colitis, but kept it together by extensive journaling and living a very simple, pretty ascetic life devoted to being a therapist. I'll talk later about my experience of having and then lacking collegial support, but my ideas about this topic right now are twofold. One, I'd like to set up a platform whereby trauma therapists of various sorts can offer support to each other and a sharing of knowledge, experience, and insights. And two, I have a particular interest in child trafficking, especially the elite kind usually associated with Yahweh and the Abrahamic religions. I'm most definitely never going to kill myself, but I want to get in contact with as many survivors and helpers of survivors as I can so that I can figure this whole system out. But I would never dream of trying to kill the snake itself because I value my life and my freedom. I'm less interested in those almost certainly well-meaning people who regard Christianity as a solution because it seems pretty clear to me that it is really just part of the whole Abrahamic problem. This view of mine is very nuanced and complicated because I know that a very many survivors find great solace and healing in the knowledge and teachings of Jesus, much of which I too still like and admire. Daniel talks about the incredible sense of responsibility he felt at being the point person in a patient's life, and the one to hear the horror of what they'd been through, having to be careful what he said, lest he inadvertently hurt someone already horribly harmed in childhood, in adulthood, by the mental health field, by therapists, with a wrongly used word, a lack of sensitivity, a brief wandering of his mind, which they would pick up on. He would take his work home, his patients' horrific stories coming out in his dreams, and he was tied to his phone and email since he worked with a lot of people who had suicidal feelings, sometimes suicidal actions. Here again, I wonder whether Daniel's life as a therapist would have been much easier had he used different tools which delve into and reprogram the subconscious mind. One of my stronger disagreements with Daniel Mackler is on Milton Erickson, the father of conversational hypnosis, one of the pillars on which neuro-linguistic programming, or NLP, was built, and one of my biggest and most awe-inspiring godlike genius heroes. Daniel, in a video on transference, says he doesn't like Erickson. In a lot of ways, he really can't stand him. He gives his ideological reasons, but I think he's missing a trick by not following Milton Erickson's methodology, either directly or through the use of NLP. Erickson achieved outstanding results, in my opinion, and didn't get burnt out, which Daniel did. Responsibility for me overlaps with Daniel's largely, but only partially. I'm probably less prone to taking on clients' trauma, except in the most severe cases, as I do use Ericksonian or NLP-based techniques, and transformations generally happen very rapidly, so that a session is energizing for me rather than depressing, and I'm usually buzzing with elation at the end rather than feeling burnt out and deflated. Distraction or mind wandering, even if I'm feeling tired, is normally not an issue, as I'm in trance with my client and laser focused on what's happening inside their mind-body. What I do really is rather like performing metaphysical mind surgery. Here again, I quickly observed similarities between ayahuasca as well as other traditional psychedelic entheogenic medicine ceremonies and hypnosis. Both involve deliberately altered states of consciousness, and both involve similar care of those undergoing the experience. I was impressed with the care taken of their groups by the two people who have facilitated all of my ayahuasca experiences so far, and how similar it was to the care that I must take with a client. With regard to hypnosis, the great Mark Cunningham likens the responsibility a hypnotist has to the person they have entranced to the carrying of a baby, supporting its head carefully, keeping it held safe and secure. As it is with hypnotists, so it is with sitters or facilitators in a psychedelic setting. After 10 years as a therapist, Daniel finally got interested in doing things other than sitting listening to people's trauma, helping them to work through it. He wanted to travel again, to make movies, to learn languages, the sorts of things that he was helping others to be freed up to be able to do. Here's a direct quote of Daniel's on his new perspective, looking back.
What is this world where certain people are designated to do this role of being therapists and to listen to people's pain and trauma and to be healing conduits? It sometimes seems a little bit ridiculous. It kind of seems better to me if everyone, or almost everyone, had some therapeutic skill and really could provide that for the people in their lives, and it wasn't put onto the role of people with titles, social workers and psychologists and therapists and psychiatrists and shrinks and all this stuff. It just seems like, yeah, in a more ideal world, it would be these helpful things, these helpful roles, the emotional support, the emotional insight would be more integrated into communities, into our regular life, and not into roles and diagnoses and this whole silly system.
And here I wholeheartedly agree, and this is what I want to set up on a global scale, a community of communities in which all members, from children to adults to elders, have and use the knowledge of how to heal themselves, and a significant proportion of people of all ages with exceptional abilities to heal are there to help others. A bit like an oceanic ecosystem with cleaner wrasses and shrimps, in which larger fish come to be cleared of dead skin and parasites by the smaller fish and crustaceans, in symbiotic, mutually beneficial relationships. Richard Grannon, in one of his videos, talks about modern society being kind of institutionally narcissistic, whereas a well-functioning traditional human settlement would not have tolerated the man with narcissistic tendencies abusing his wife, for example. We've got to reform for ourselves these kinds of self-healing, self-regulating, balanced ecosystem communities and societies. I also, as I intimate in the Heal Up and Thrive Masterclass, want to focus not only on getting people healthy mentally and physically, but to go on to coach people to live soul-fulfilling lives. Another perspective on which Daniel Mackler and I differ is children in therapy. He has a whole video on why children don't belong in therapy. in which he argues that it's normally the parents, not the children, who really need the therapy. The comments section for this video largely bears this out, though there are exceptions where people say that they benefited from childhood therapy. In my experience thus far, it has been decent parents who've brought their children to me. In a few cases, the children had already been to the UK National Health Service's Child and Adolescent Mental Health Services, or CAMHS. In none of the cases had CAMHS done the children any good, and in all but one case, the children whom I followed up on were significantly better after one session with me. The exception was a young girl who had problems but refused to follow my instructions in anything more than a half-hearted fashion. Eventually, I told her mother it wasn't going to work and cancelled the session and didn't charge for it. I'm always wary when someone, adult or child, has come to see me because someone else has booked them in or wants them to be there. Belief that what I do will work is not essential, but a desire to change and a willingness to follow my instructions are definitely necessary. I am adamant that children do belong in my sort of therapy, something that actually works. What tends to happen with childhood trauma is for it to repeat, often cyclically. For example, if a child experiences an initial traumatizing event at the age of 6, often something will occur at 12, which engenders a similar horrible feeling, then again at 18, and again at 24. If I can intervene and clean things up as soon as possible after the child starts exhibiting problems, I can potentially rescue someone from this cycle before they end up a multiply traumatized adult, with a string of abusive relationships in their wake, for example, and maybe traumatized children of their own. I want children to be taught my methods en masse so they know how to clean up their own trauma-based mental health issues so that they never have to carry emotional baggage for any length of time, and for children with a talent for it to help other children to heal and be unburdened, with many sharing the work like the cleaner fish in the ocean ecosystem. This work done properly and skillfully is very, very rewarding, and learned early in life may play a big part in rescuing our society from the brink of doom. There is an element of talent or aptitude to this work. In his critique on psychotherapy video, Daniel Mackler refers to good therapists as healers and artists, which requires both innate talent and proper training and practice. I already mentioned his observation that someone with a natural gift as a therapist could be made a worse therapist by mainstream training. I absolutely agree with him on both these points. On the other hand, I have also observed at least one individual with a good heart practicing some of the powerful, effective methods that I use, but just not having a knack for it. A bit like a tone-deaf wannabe musician, which is something I've also encountered. I found that I, on a few occasions before I knew these tools even existed, would have a single conversation with someone which would immediately transform their outlook on life, which is something Milton Erickson was wont to do. So I guess I had a natural talent for this work. I will therefore be looking for people with both a desire and an aptitude to help others, so I can train them in order to manifest the human ecosystem which has emotional healing and hygiene as an integral part of it, without the job of trauma healer being an overwhelming burden on only a very few, just as Daniel also envisions it. Gabor Mate is another mainstream trauma and addiction therapist whom I really admire and appreciate. I have yet to explore his books and may find that I don't agree with him on everything. A friend who may run a parenting course here was a bit disappointed with one of his books, considering him not to have gone far enough in his conclusions. But so far I found his opinions and advice to be sound and very, very helpful. Bessel van der Kolk, author of The Body Keeps the Score, is profoundly wise and accurate, but I think he's made himself something of a pariah in many mainstream therapy circles for exploring just a little bit too far outside the box.